Hi everyone, welcome to this show, and it gives me immense pleasure to welcome Dr. Armaan Riaz, who has got an amazing rank of rank 1, both AML and CML in the INISS rheumatology exam. As we know, there are hardly handful of seats, like you can't even, say you can count them on your fingers because hardly it's like 2, 3 seats. And especially if you look at, if somebody wants to go into the not the newer aims, etc., then they have only one seat to work with in your mid-year exam, and maybe 2, 3 in the year-end exam. So it's so competitive, and firstly taking the decision to go for RUMAT, especially in the INI, is itself takes a lot of courage, and then to come out with such flying colors, that is rank 1, like it's a great achievement. So Arman, how are you feeling firstly?
So I feel very happy and honestly, I feel a bit relieved that I could be able to do this, and again, I feel humbled also for this achievement.
Awesome. Like, firstly, like introduce yourself, because obviously we've been chatting a little bit, but our viewers would like to know where you're from, how your academic journey has been.
Yeah, so myself, Armaan Riaz, so I belong to Kashmir Valley, part of the UT of JNK, and I have done my MBBS from GMC Srinagar, and I have done MD medicine from PGI Chandigarh. I have completed it in December 2024, and so in about a year, I have left from the institute.
Great. And like obviously, after your MD, you would have taken some time, or through your MD, you would have made this decision of coming to rheumatology as a choice of exam. So how did you make that decision? How did that inspiration come from?
Yes, sir. I think in PGI we are exposed to a lot of rheumatology. Actually, the core department itself is like the half of the department is IM1 and half is IM2. The IM1 part is the rheumatology department, and so the exposure is there of rheumatology. During my MD medicine days, mostly I didn't decide during the by the during the entire course. I wasn't able to decide actually which particular field to choose. So actually interested itself in the medicine itself and its broader perspective. So I like that part only. So by the end of the course, I think that some there you have to make a decision whether you want to stay here, just medicine, you or you want to choose a higher specialty. So as we all know that the current super specialization, the growing super specialization that is happening in our country and everywhere. So I think I decided by then it's appropriate to choose some super specialty. So that time I thought that which super specialty would be a bit closer to medicine and would, I think, in my opinion, just my humble opinion, I think that many super specialties, once you go into super specialty, uh, it restricts your vision to that specialty. And rather than empowering you, it makes you a bit like your vision becomes a bit, yeah, that's I think in rheumat and especially in the rheumat that we see in PGI, it isn't like that because most of the medicine is seen by SRs in rheumatology or in IM1 course itself. So that way, I think that is quite empowering. In the institute has a very good program itself for the specialty as well as for like the medicine part of it as well. So that's what made me decide to choose rheumatology.
Great. Like I've seen this, that there are many students who, after coming into internal medicine, want to continue in internal medicine, but obviously because of the practicalities and how our health system is structured, you end up having to give this DM exam, and most of such students come into rheumatology itself. And I'm sure when you would have seen already, but as you go through the course training itself, you would again this feeling would get kind of strengthened, that there is always a mix of patients in the ward. There is no all one set of patients. Like sometimes our ward becomes a cardiology ward, sometimes our ward becomes a nephrology ward with all lupus nephritis, a lot of times it becomes a hemat ward, right? So that would, you'll love the branch with what vision you're entering, that will stay. I'm sure. So next,
Yes.
let's come to your journey. That's what students would want to hear, your juniors would want to take guidance from, especially from the INISS perspective. And just to inform our viewers, Arman was ranked 2 in the NEET SS as well, the previous NEET SS, but he really wanted to, as he told you, where his inspiration comes from for getting into PGI, and that's why he has sat again and he has come out with flying colors. So firstly, your INSS prep, and then we'll talk a little bit about how you thought about NEET SS as well.
Yes, sir. Actually, at the end of the medicine course, I gave a rheumatology INSS exam. That time I hadn't actually thought well about it to settle for rheumatology. I was not very sure whether to give this one only or not. So I didn't prepare much. Maybe some 20, 25 days before it, I decided that I'll be giving rheumatology. So I studied full on rheumatology that time for those days. And then I was not sure if I would get anything because I didn't think that my preparation was up to date. So fortunately, I got eighth rank in that first time, and I felt like choosing rheumatology itself, as you know, is it's like very difficult to make that choice because the seats, as you said before, are very small in number. So if you want to commit to that subject, you have to know that you will be able to do it. If you cannot get through it, then in midway you leave it. It will be like a disaster. So I felt like if without preparation I was able to do it, so maybe I should proceed further. So then I decided to study for the 6 months, and by March we had this NEET SS exam. So at that time, my preparation strategy was like for NEET, I prepared initially the entire medicine part for Jan, Feb, and till the NEET exam. I prepared again the medicine part. I wanted to be at least because you love it for the medicine only. So the
Yeah.
medicine part, I read it completely and prepared for a NEET, and then gave the exam. Then we had about, fortunately, that time we had about 1.5 months to study for INISS. So in that part, uh, already the basics were clear from Harrison's, which I had read before also. But then the rheumatology part, core rheumatology like the Kellys and those hardcore topics like joint systemic rheumatology, pharmacology part. That part I was able to finish in that 1.5 months, along with revision and that previous medicine. And I appeared in that, and so actually that time it was a very difficult time for me. Just when I was appearing for INI, that time the NEET SS result had come and I had got two rank. So I had to decide whether I should take some college in from via NEET. Obviously, the best college there is SGPGH Lucknow, and also Nizam, Hyderabad. Those two colleges I was considering. So that time, the thing is that two things was that in SGPGI I thought about the bond, a 2 years bond, and spending it at a place. It's very like far from home, so felt like 2 3 years maybe you can spend it, but 5 years it felt a bit difficult, and some personal reasons also for that. So I decided that I would not be choosing it via need, so I decided to give it up and write it for INISS. That was a very critical decision. In hindsight, I felt like things could have gone wrong very badly, and that time they went wrong. So I gave INISS and then hope to clear it, obviously, but you can never be sure that you will be ranked one. You can always try, but I will say this to all of my colleagues, like people who are preparing for rheumatology. I believe that like most of the top 10 students there, they have exactly the same amount of preparation and probably the intelligence also. So we try to get inches and bits ahead of each other, but basically it's the same thing. So that's a matter of luck and chance. You get one gets earlier ahead, the other one gets after that. So I got second rank in INSS. So that time, that was a very difficult time for me. like leaving behind NEET and then also not getting it in INSS. And you obviously have to make a choice whether you want to take an AIMS, peripheral AIMS institute, or you want to give it again. And at that time, I didn't have the option of taking any NEET colleges because like
The
already I had
counseling
given up.
might have passed. Yeah.
Yeah, yeah. So I thought like before leaving that seat also the two things were going on in me. Like if I don't pass this exam INSS, it's either like you have to spend 6 more months, or the other thing is you have to spend 2 years. So if you manage to crack it next time, you might end up saving 1.5 years. By saving, of course, I mean that you will not be there by
Doing the bond.
obviously, yeah. So, but the it's always a big if, because the
Yeah.
big if is like first getting one rank. So that's a difficult decision. Finally, I decided to just take a leap of faith and give it one more try this time. So I think in this session, so since NEET is in December, it's coming only. So this time, my focus was primarily on this rheumatology only part. So I think Kelly's I had already read, and I had made notes out of Kelly's the important parts. And this session I studied mostly Hodgberg only. So Kelly's I used to revise from my notes only, and I used to study Hodgberg and make notes. I think those help. What is important is that while we are trying to read these, this all material, textbooks and guidelines and everything, you have to keep on testing ourselves again and again. So that's where the Q bank and test series helps. So I think like in rheumatology, the best test series is probably of doc tutorials. I don't think there is any other one which compares, because it's like specifically for rheumatology part that covers it almost every topic and the depth in which you require to cover it. So that part I had covered already. I had covered in initial 6 months when I had got ranked. To that time I had covered. I'm not actually that very pedant after doing MCQs again. I think I had covered it once or twice, important topics. So that part I did. Then in second part, in this chance, like when I studied the Hodgkin part, because the corrections which I used to get wrong, those I had already noted. So I didn't need to do the entire MCQ tests completely, only the parts that I used to get wrong. And mostly it just reinforce the concept that you used to get wrong, so that you could just improve. So that's how I did it in this part. Finally.
Great. I mean, two things that you touched upon very nicely. One is the use of bookmarking, or like, getting the questions wrong and then conserving your time the second round, because you obviously don't want to do the easier, set of questions again. So bookmarking is one feature that everybody must use, especially to do the second round of questions. And the other part is, yes, as you said, INI definitely has a lot of luck. Might not be in your case because your bases and you had a very strong background already getting rank 2. So I would say if you didn't get rank 1, it would have been bad luck. But yeah, I agree with you that INIs always has good chunk of luck involved in the result. And I would say always students, especially in the earlier attempts, should think about NEET as a very strong first exam, and then add on as INS as a complementary exam or a possibility, because you can't always guarantee rank 1, especially if somebody is from North India and they might not want to go to JIPMER. And in that case, should always keep NEET as a very strong possibility. So two very strong points covered. And yeah, so as we know from your rank, you did very well. I'm in the interview as well, right? So because CML1 and AML1, so you did at least, like, you did improve your rank. Obviously it can't be improved, but you did enough to get into AML1 as well. So how was your mock interview strategy, and did you think about any preparation wise or strategy wise? How was that part?
So I think in this entire like the journey of giving exams, probably interviews are like the most anxious things, like the most anxious part of this thing, because you are face to face, and of course you are face to face. In my case, I was face to face with the faculty with whom you have already interacted, but it's a different setting, and like it's very objective. I think the Rheumat PGI based this exam is very objective. Like you get points in 13.5 and 13.7, so
Mhm.
you understand what they value and what they did a
Yeah.
very strict. But it was always it's the most anxiety provoking part is always the interviews. But you like last time, since I had appeared before in interviews, so I knew like the pattern. Like obviously you cannot predict what they will ask, but you understand that they are trying tend to ask the clinical aspects more, and they tend to ask like the disease evaluation part, the like the outcomes part they tend to ask, and newer things they tend to ask. This time there was like they asked about some very practical management aspects of disease. So just I was trying to cover my basics only, and just focus on that evaluation aspect of diseases, like what actually and what actually you are supposed, once you enter the rheumatology, what you are supposed to know, like what how to write a prescription, or how to what are the things that you evaluate before giving any particular immunomodulator or like that. So those things that should be clear. So I was just preparing for that only I kept in mind. Didn't think too much about it, because just thinking would it always provokes more anxiety. So knew like I knew it from last time also, uh, like interviews are always like if you do to some extent good, you may get through. But the basis I think for cracking like INISS rheumatology especially part, I'm not telling about the other parts, is at least you have to get your theory right. Because if you are able to get theory right, then in interviews mostly there will not be much difference between one and two in terms of points that they will assign. So if you get your theory part correct, you will be able to do in interviews. You will be able to.
Great. So like, and also like for your juniors who are coming through MD as well as post MD, what are some guidance points? Like you faced some things that you could have retrospectively improved upon, whether taking decisions on the branch or whether through your preparation, something that you would like to say to help juniors who are coming up.
Yeah. So I think like two things. One is like during MD course itself, like there is an opinion, or there some people try to do the specialty that they are interested in early in the course. They try to do like third semester or fourth semester, or they try to go for it. My personal opinion is that we shouldn't do it. Like it's my own opinion. Uh,
Yes.
we take medicine for the love of medicine, obviously, and I think we should fully study that part in our course. Because ultimately when you want to commit to a particular specialty, and if you have decided to commit it by first year of MD course, like the other part, maybe for some people it may not be that much of a compromise, but I think it is always a compromise. So because especially this specialty is highly like medicine oriented specialty, or like medicine based specialty, I don't think we should compromise on that. So I would just say that during medicine we should have a very dedicated focus on the medicine part, the entire medicine. In that part was also held by our postings. Like in PGI we have postings in different departments. So when you go to a department, you get to see the core of the department, and you are fully dedicated to that particular part. So you read it, and then you read it from Harrison, and you see what is new. So because I would never say that Harrison is a complete book for MD medicine. There's always like some aspects that are missing, some aspects that are to be added. But what is missing and what is added, that you get to know where your teachers, where your seniors, and where your postings. So I would say that during MD course, we should stick to medicine only, or whatever specialty we are appearing, whatever. subspecial like pediatrics or sometimes other. So we should study that core. It's important to have an important core of a subject. And then after that, if you want to commit to a specialty, so the approach is like twofold. If you want to give NEET SS or you want to give INSS. For NEET SS, I would say that it is important to cover the breadth of all the subjects, like all the nine or subjects that you are supposed to cover. You have to cover everything, but you do not need to go into very depth of the each subject. But the strategy is opposite in INSS. You need to go into complete depth of the particular subspecialty that you are appearing in INSS. So if you have a mind like that, you if you have done your core medicine well in your MD course, you can appear in NEET SS. So it will not be very difficult to appear. It will not be very difficult to prepare for it. But if you want to appear in INISS, you may need some 6 months to prepare for it, and that 6 months should be focused on that subspecialty. And in especially in rheumat part, I would say like you have to know anything and everything. They can ask anything in like I think every topic that you study. I felt like this, for example, in case of myocytes, I felt like however deep I used to study, I used to get one question always wrong. And I don't know, some new antibody or some new clinical manifestation, they always try to bring it. And one question you will all, I always at least got it wrong. So like that, so I think also the what I realized like appearing in INA, I realized that it's the difficulty part is also growing. Like it's there, the papers are also getting a bit tougher and tougher. So you need to really study the subject of if you are appearing in an INS specialty, you need to study it in core, in depth. So that part, and the other thing is like notes and questions, because it's all we have like we have an intrinsic bias that we tend to think that we know about the subject. But when those biases are removed, when you do questions and test series, so you come to understand what your weaknesses are. So it's important to test it each time. So maybe 2 weekly or maybe monthly, you can give a grand test and you can understand about the topic that you have read. It's I believe that first you should read the topic completely, then only give a grand test. Then whatever wrong you have gotten, then you can go back to it. And the other thing is about the notes. I'm not actually a person who's very pedantic with notes. During my entire MD medicine, I haven't made in any notes. I prefer to read from book only. But for specialty, appearing in a specialty, I think the most important thing is number of times you are able to revise. So for completing the MD medicine course, I'm not big on notes, but for appearing in a specialty, I think you have to make notes. And like there are available notes, they are already available from various platforms. You can take them, you can read them. But what is important is that everyone can do that. So especially in rheumatology, what gives you an advantage? You have to personalize the notes, because once you read a subject in detail, like you read rheumatology, you read a topic in detail, you can either take those pre-made notes, just personalize them what you, because everyone reads differently and everyone has different weaknesses which only a person himself knows. So you can just mark them whatever you feel like this is the thing that I forget, so that you can mark. And that will also help because at least there are two books in rheumatology that you are supposed to read, like Kelly's and Hodgberg. And sometimes they will give from Kelly's, sometimes it will be based on Hodgberg. Personally, I found Hodgberg to be much better, and I wouldn't say anything like better compared to Kelly or anything. I would say that much more easier to read and much more containing informative. Like Kelly's is like the Guyton, we used to say like in physiology, the Guyton, and like Hodgberg is like the Gannon part. So it looks like that to me. So because once you're made notes from Kelly's and you read something new and you find something that's not mentioned previously, you can add that on your notes. That will just help in revision. I think in just if you can finish your at least revision by about you should be complete by about 1 week before exam. It should have been done. Just papers and guidelines and all whatever you want to read, whatever is supposed to be read, that should be complete by about 1 week before exam, so that you can get adequate time to just revise. Because just before exams, at least I was not able to read much.
Sure, like excellent guidance, and I think juniors will listen to this interview with open ears and take a lot of things that you said. And finally, like after all the journey and the excellent rank, like whom would you like to thank through this journey of yours?
Obviously, sir, like I said, it's a matter of luck, and no one can be sure about getting one rank. So it's always a luck, and it's always God grace. So I thank God for it. And obviously, your support system, my parents, my friends, and of my like seniors, senior residents, and my teachers who helped me during this time. Like it helps a lot when someone who has cracked an exam, he can tell you, he can guide you more about how to do and what he did wrong. That helps more. So we had so many helpful SRs in the department who were very helpful, very guiding. So they helped a lot. Um, Once again, Alhamdulillah, I thank God.
Thank you so much, Arman. It was so nice talking to you, and it was so nice, talking to you after a long while and knowing you. And obviously, we'll be meeting in conferences and across rheumatology. Welcome to rheumatology, and
Thank
I'm sure you'll have a great time. Thank you.
thank